diagnosing for diabetes? What tests do you perform?
Right, so the American Diabetes Association has some guidelines and diagnostic criteria to diagnose diabetes. So it's basically a fasting sugar or glucose, blood glucose of 126 and above, a hemoglobin A1C of 6.5 and above.
And can you explain that A1C? Is this a blood test?
This is a blood test. Both of them are blood tests.
Got
the
it.
hemoglobin A1C is the percentage of the hemoglobin that has, let's say, a sugar attached to it.
Got it.
Okay. And is representative of the average of blood sugars in the last 3 months by the time the blood test is drawn. Okay. And it comes in an expression of a percentage. So 6.5% or above is diagnostic of diabetes. Also, if a glucose tolerance test is performed at 2 hours after a glucose challenge, blood sugar of 200 and above, or a random blood glucose with symptoms of 200 and above. So those are the main diagnostic criteria.
And when you get the diagnosis, and I know every patient is different, obviously, and every diabetes is different, but is your approach, okay, immediate medications or lifestyle changes?
Well, it depends on the severity of the diabetes. So the severity of the diabetes, you get a feel for it based on how high the blood sugar is at one point in time. You can always do an in-office finger stick, whether it's a pre-meal or post-meal blood sugar, that gives you an idea. How high the hemoglobin A1C is, and very important, if there are symptoms. If there are symptoms, like the ones you showed before, then that's clearly a type of diabetes that requires treatment, okay? If it's a mild case of diabetes with a low hemoglobin A1C, glucose that is not so high, and the person is asymptomatic, then you can try lifestyle changes first. Although I have to say, lifestyle changes should always be in place. Whether you use medications or not is a different story.